I do think we're sort of standing on a precipice right now where in some ways science is losing its place as a source of truth. People are just declaring their own scientific truths. And I watched the anti-vaccine movement really grow bigger and better funded.
Hi, this is Jane Caldwell. Welcome to the On Medical Grounds podcast, your source for engaging, relevant, evidence-based medical information. We're hosting a 3-part series on polio, a serious disease that was almost totally eradicated in my lifetime due to polio vaccination programs worldwide. We'll be talking to polio survivors, healthcare providers who cared for polio victims, and a noted expert on polio vaccines. Today is part 1 of Polio Confidential, Stories from Those Who Lived It, the continued path toward prevention. Today I'm speaking with Dr. Paul Offit. Dr. Offit is professor of pediatrics and an attending physician at the Division of Infectious Diseases at the Children's Hospital of Philadelphia. As director of the Vaccine Education Center at that institution, he is an internationally recognized expert in the fields of virology and immunology. Dr. Offit is a member of the FDA Vaccine Advisory Committee. In 2011, he wrote Deadly Choices: How the Anti-Vaccine Movement Threatens Us All. This book was selected by Kirkus Reviews and Booklist as one of the best nonfiction books of that year. More recently, he has written Tell Me When It's Over, an insider's guide to deciphering COVID myths and navigating our post-pandemic world. Hello, Dr. Offit. Thank you for joining us today.
Thanks for asking me.
Before we talk about polio, I'd like to ask a few general questions for our listeners so they know who you are and where you're coming from. First, I'd like to take you back to 2008 when you published a book called Vaccinated: One Man's Quest to Defeat the World's Deadliest Diseases. You were friends with Maurice Hilleman, and you interviewed him extensively for that book. His vaccines have been credited with saving millions of lives. How did he shape the way you view vaccines and infectious disease?
Well, he was this brilliant man who really was the principal either inventor or developer of 9 of the 14 vaccines that we give to infants and young children. It's just a remarkable, in many ways, unimaginable accomplishment. It's like trying to imagine a 4th or 5th dimension. He had been a friend for 20 years. And in October of 2004, he was diagnosed with disseminated cancer and given roughly 6 months to live, which is exactly how long he did live. He lived till April of 2005. And, I asked if it would be okay with him if I would interview him periodically during that time. And I did about maybe 65 or 70 hours of interviews just to get his life story. And he was nice enough to allow me to do that. But he was an inspiration. He was never satisfied. He was this sort of brilliant man who was never satisfied. And even at his deathbed, his regret was that he didn't do more.
You've published over 160 scientific articles and written at least 11 narratives concerning medical misinformation and the risks and benefits of science. I know physicians lead very busy and complicated lives. Why take the time to write and publish? What do you hope to accomplish?
Well, I enjoy writing, and I sort of get up every morning early, around 4:30, and write for a couple hours before I go into work. But it's to try and influence thought. I do think we're sort of standing on a precipice right now where in some ways science is losing its place as a source of truth. People are just declaring their own scientific truths. And I watched the anti-vaccine movement really grow bigger and better funded. You could argue that with the possible succession into Health and Human Services by Robert F. Kennedy Jr. or the pick of Dave Weldon as head of CDC, that the anti-vaccine movement has moved into the mainstream. And I think children are going to suffer that. So I write to try and prevent that.
I see. To me, your narratives seem balanced because you discuss not only the benefits of science, but some of the downsides and risks. On a technical note for our listeners, how do advisors to, say, the CDC and FDA decide when things have gone too far and are too risky, especially in the vaccine world?
Well, there are many examples of that. I mean, you look at, for example, just with the COVID vaccines, we had the 2 mRNA vaccines of Pfizer and Moderna in December of 2020. 2 months later, we had a different vaccine, Johnson& and Johnson's vectored virus vaccine, which was found fairly quick to be a very rare cause of something called blood clotting, including clotting in the brain, including fatal clotting in the brain. It was very
Mm.
rare, but it was real. And so you had now these 2 different vaccines, one of which didn't cause fatal reactions and one of which did. So I think it became clear that vaccine had to come off the market and did. The same thing with the oral polio vaccine. I think we got to the point where more cases were caused by the vaccine than were caused by the wild type virus in this country. And so we had to get away from that oral polio vaccine and did by the year 2000.
Mhm. Many of your writings are medical histories, and one of your first books was about polio. Could you briefly outline the history of polio and the discovery of the first polio vaccine by Jonas Salk?
Right. Polio would, at its worst, cause as many as 50,000 cases of paralysis and 1,500 deaths a year. More typically, it was 20 to 30,000 cases of paralysis. It was often children, 5 to 9 years of age, that were paralyzed, and they were paralyzed for the rest of their life. And those who had paralysis of their respiratory muscles had to be put in iron lungs. Some of them were put in iron lungs for decades. I happened to actually be in a polio ward when I was 5 years old at the Cernans Hospital for Crippled Children. I didn't have polio, but I had a failed operation on my right foot from a congenital abnormality, which landed me in this ward. And, it was like a Dickensian experience. There was only one visiting hour a week on Sundays from 2 to 3. I saw children in iron lungs. I saw children in traction who were getting these so-called Sister Kenny hot pack treatments, where we take these excruciatingly hot packs and put them on withered arms and withered legs in hopes of restoring movement. And so children were screaming, children were in iron lungs, you know, parents weren't there, and it was just living hell. And that is my recollection of polio. And it's certainly not a time that we want to ever go back to.
Wow, wow. Um, the polio vaccine was developed at a time when our society was embracing science. Antibiotics were in production for the first time, so infectious diseases were on the decline, but polio was still ravaging children. There was this long campaign of information on the polio eradication effort. When the vaccine was declared safe, I was told that church bells rang and loudspeakers in stores would announce the news, and people jumped on it. People lined up for their children to get it. How is this different from our environment today?
Well, it couldn't be more different. I mean, today, if you back in Jonas Salk's time, when he invented a vaccine, which he did by taking polio, growing it up in cells, purifying it, killing it with a chemical, and that vaccine worked, and it's really, really very much like the vaccine we use today. Um, he was a hero. He had ticker tape parades. Now, if you're a inventor of a vaccine or a co-inventor of a vaccine, you're considered, a bad guy. But it's just it's a very, very different time. I think part of it was just people were much more society minded. I think the focus wasn't as much on the individual then. We thought of ourselves as a group, as part of a whole, which don't think we think of today. And there's just enormous distrust today, distrust of the whole public health infrastructure, whether it's FDA, CDC, NIH. People are just very quick to reject that and to reject expertise and to reject experts. And it's a troubled time.
Mm. I'd like to talk briefly about the Cutter incident. In April 1955, more than 200,000 children in 5 states received a polio vaccine that was defective and actually contained active virus rather than attenuated virus. And within a month, that first vaccination program against polio had to be paused. Can you explain to us what went wrong and what the government could have done to prevent that?
Well, at the time, we didn't really have an infrastructure for vaccine regulation. There were sort of some people at NIH that while doing their other research would sort of supervise programs like Cutters, and it was the birth of vaccine regulation in the U.S. The problem was the filtration problem. So poliovirus grows in cells, and it was inactivated or was supposed to be inactivated with formaldehyde, a chemical. but because there was an inadequate separation of the virus from some cells and cell debris, some of the virus hid in those cell debris. And so it wasn't the formaldehyde wasn't able to get to the virus. And when that was realized, then the process was changed and it wasn't a problem anymore. But it was a killed vaccine that wasn't killed, and as a consequence, a couple 100,000 children were inoculated with live, fully virulent polio virus. Some suffered, or many suffered, abortive polio, meaning short-lived paralysis. Many suffered permanent paralysis, and 10 people were killed. I think it was probably the worst biological disaster in this country's history, and it's amazing to me nobody knows about it. It really was that bad. Imagine something like that happening today.
Well, that's my next question. Even after that Cutter incident, many parents went back to vaccinating their children. Do you think parents now would be willing to go back after an incident like that?
They're not willing to do it now. Vaccines are effective.
I
So,
see.
no, I think
No, no.
I think it was a different time. You're right. I mean, it was people they trusted the companies to figure it
Sure.
out. They trusted the federal agencies like the FDA and CDC to supervise it. And even when it had gone horribly, horribly wrong, they still trusted them to get it right. It was just a very different time than today where we are enormously distrustful in situations where we shouldn't be distrustful.
Sure. Would you describe the Cutter incident as maybe the birth of the modern anti-vax movement?
I don't think so. Because just for the reasons you said, I think people still trusted it still got vaccinated. Very quickly, we vaccinated the population with polio vaccine. No, I think the birth of the modern American anti-vaccine movement was in the early 1980s with a TV show called DPT Vaccine Roulette, which falsely claimed that the whooping cough or pertussis vaccine was causing permanent disabilities. It was done by a woman named Lee Thompson, who was a reporter then, and it just had enormous impact. People thought, "Oh my God, this vaccine isn't doing what it's supposed to do. It's not only not necessarily protecting against whooping cough, it's causing these horrible neurological disorders like epilepsy and others." And it really changed the landscape here, I think. And DPT, there was a group called Dissatisfied Parents Together, which eventually became the National Childhood Information Center, National Vaccine Information Center. And it was off to the races. Companies were sued and sued and sued. We had to put in the National Childhood Vaccine Injury Act to at least partially prevent these companies from this frivolous civil litigation. And, it never was true. Which is interesting is that wasn't that vaccine didn't cause permanent disabilities, but it took, even though study after study showed that it didn't matter. It had already been put into the consciousness of people in this country, and it was off to the races. The anti-vaccine movement was born. And now, after the pandemic, it's even better funded and even more influential, and has now risen up into the top tier of government, with people like Robert F. Kennedy Jr. being considered as being head of or Secretary of Health and Human Services, when he has said on a recent podcast, when asked the question, is there any vaccine that you consider beneficial? He said, no.
What do you think motivates anti-vaxxers?
I think for most, it's a real belief that vaccines has caused harm. Vaccines are given to many children, more than 95% of children in this country, and they are designed to prevent specific vaccine preventable diseases, specific viruses and bacteria. But they don't present everything else that occurs in life. And there's often these temporal associations between got a vaccine, had a problem. I'll give you a perfect example. My wife is a private practicing pediatrician. She went into the office on a weekend and was helping the nurse vaccinate the children because they were getting behind. But there was a mother holding a 4-month-old on her child's lap. While my wife was drawing the vaccine up into the syringe, the child had a seizure, and went on to have a permanent seizure disorder, epilepsy, and actually died of a chronic neurological disease at age 5. If she had given that vaccine 5 minutes earlier, I think there are no amount of data in the world that would have convinced that mother of anything other than vaccine caused the problem, right? Child gets a vaccine, has a seizure, now has a permanent seizure disorder, now is dead of a chronic neurological condition. The vaccine caused it. I'm the mother of a vaccine-damaged child. And that's what you're up against. You're up against these emotional temporal associations, and you're trying to defeat them with statistical arguments.
Hmm. Let's talk about polio. Has polio been eliminated? And if not, what is its present status, both in the U.S. and globally?
So certainly natural polio still exists in the world, places like Afghanistan, Pakistan. The problem is, and it's not discussed as much as it should, The oral polio vaccine had a problem which wasn't trivial. This was the vaccine that was invented by Albert Sabin that came onto the market in the United States in the early 1960s. And it was great. It was cheaper. It could be given by mouth. There was something called contact immunity, meaning you would actually shed vaccine virus in your feces, and therefore, about with hand mouth behavior, there was about 25% of people in the home would be vaccinated even if you didn't vaccinate them. That's contact immunity, and it could be given, without require. It wasn't a shot, so it didn't require sort of sophisticated medical personnel to give the vaccine. And it eliminated polio from the US. By the late 1970s, polio was gone from the US. But this vaccine could itself cause paralysis, and it caused paralysis in 8 to 10 children every year. And throughout the 1980s and throughout the 1990s, the only cause of polio in the United States was the polio vaccine. So we then replaced that back essentially with the Salk vaccine, the inactivated vaccine in 2000, and that's the only vaccine we've been using for the last 25 years. But the virus that could revert to essentially paralytic type, the oral polio vaccine could mutate back to essentially a virus that could cause paralysis, the so-called, revertant virus. Though that's still in sewage samples, still around. That virus that could cause paralysis is still around. And that's what happened in Rockland County, New York in 2022, when a 27-year-old man living in an area that had immunization rates less than 30% against polio got polio. And, as you know, with polio, only about 1 in 200 people at most who are infected with polio are paralyzed. So when you see a case of paralysis, you can assume it's the tip of a much larger iceberg. And when they looked in wastewater samples where he lived, Rockland County or suburban counties, they found that virus. And I think if you looked in Philadelphia, you'd see it, or Chicago or LA. I think that revertant virus is around. He was infected with a type 2 revertant vaccine strain. And that's what's happening in Gaza right now. It's that's what's causing paralysis. It's not wild type virus. So I think that's the sort of Faustian deal, if you will, that we made with the oral polio vaccine that was made by Albert Sabin.
Hmm. Why is polio a particularly dangerous and insidious disease even today?
Well, it affects health. It affects healthy children, and they're many are permanently paralyzed. No, I can tell you, no disease was more feared when I was a child in the 1950s than that virus. I mean, they wouldn't. My parents would not let me go to a public swimming pool. I had to swim with my 2 cousins in that little sort of plastic pool that you'd wade in the backyard. That's where me and my 2 cousins swam. And it really is the birth of summer camps. I think that those summer camps in upstate New York, for example, New Hampshire, Vermont, Maine, those were born of the polio epidemic. Parents wanted their children out of the city in those summer months because it was a summer plague, if you will.
As you know, most of the people who directly cared for polio patients are no longer alive, and most of the individuals who survive most individuals who survive polio in this country are older. How does that impact our current society and how we view polio? Have we just forgotten?
We've forgotten. I think people don't remember this disease. I think they just see it as a series of black and white pictures of children from long, long ago. And it's too bad because I think it's not just that we've eliminated polio, we've eliminated the memory of polio. And with this case now in Rockland County a couple of years ago, I have a fear that if people think, well, why am I vaccinating against this virus? I don't even see this disease anymore. Let immunization rates drop low enough and polio will come back.
There's a lot of talk in the media and among healthcare professionals like yourself about a potential resurgence of polio and other vaccine-preventable diseases due to the rise in the anti-vax movement and the incoming political administration. Should we be afraid?
Yes, we should be very afraid. I think you're seeing a dramatic increase now in cases of measles and in outbreaks of measles. We had an outbreak recently in Philadelphia. There was an outbreak of 85 children in Columbus, Ohio recently. You're seeing a 5-fold increase in pertussis or whooping cough. In the past year, we had 200 deaths in children from influenza, which is very high. I think the CDC recently published data showing that a larger percentage of parents are exempting their children from getting vaccines in kindergarten than ever before. There are 14 jurisdictions where more than 5% of kindergartens were exempted or their parents had exempted them from getting vaccines using philosophical exemptions or religious exemptions. And that has dropped below the level of herd immunity. So now we're seeing these outbreaks occur. I think they'll only get worse.
How much control does a political administration actually have on vaccine approval and recommendations?
They have a lot of power. So, for example, it could be that a company would submit a vaccine for licensure. The FDA could say, "I think this should be licensed." The CDC should say, "I think this should be recommended." And the head of Health and Human Services could say, "I don't think it's been studied enough." The head of Health and Human Services could say, "I want to take these vaccines out of the vaccine injury compensation program and subject them to the slings and arrows of outrageous civil litigation, and then watch what will happen. Those vaccines will also come off the market." Vaccines aren't big moneymakers for these companies. They're given once or a few times in a lifetime. They're never going to compete successfully with, diabetes drugs or psychiatric drugs or lifestyle products. And lipid lowering agents, I think, which you're taking every day. So you're going to, this is a very friable market, if you will. It's a fragile market. And I think these companies could drop vaccines in a second.
As an older American, I got my polio vaccination in the 60s. Should I get a booster?
No, you're good. I think if you were fully vaccinated, you're good. I mean, it's a long incubation period disease. All you need is immunological memory, and you likely have immunological memory that will last for a lifetime.
Good to know. Good to know. What would you recommend that a healthcare provider say to a patient or a patient's parents who might be questioning vaccine safety?
Well, I think it's reasonable to question vaccines. I mean, we give them to healthy children. I think it's reasonable to be skeptical of anything you put into your body, especially vaccines, which are biological agents. But you shouldn't be cynical. I mean, you should be willing to accept that there are data showing efficacy, there are data showing safety, that there are systems in place like the Vaccine Safety Data Link or the VSafe system or others that are there to pick up rare events if they occur. So, I mean, look at the mRNA vaccines. I mean, that issue of myocarditis was picked up very quickly. And even though it was very rare, like 1 in 50,000 was picked up very quickly. So there are systems in place to sort of ensure safety because they have to be in place because we give vaccines to healthy children. So we have to have those kinds of systems.
COVID-19 deaths greatly outnumbered polio deaths. Yet there was a massive spike in the anti-vax and anti-science movement with this recent pandemic. In hindsight, what could the government, healthcare providers, or medical educators, what could we have done differently?
I think what happened in 2020 when we didn't have anything, right? All we had was a virus that could be transmitted asymptomatically. Anybody you passed in the street could be shedding a virus that could kill you. We didn't have antivirals till October of 2020. We didn't have monoclonals till November. We didn't have vaccines till December. We had nothing other than avoid human-to-human contact. So that's what we did. We closed businesses. We shuttered schools. We restricted travel. We isolated, quarantined, masked. And I think that alone was seen as massive government overreach. People didn't like that. They didn't like that we closed schools. They didn't like that we closed businesses. And then extending into 2021, once we had a vaccine, you had vaccine mandates. You couldn't go to your favorite bar or sporting event or restaurant or place of worship unless you showed you had that card. And you just started to see pushback, all in the name of quote unquote medical freedom. That's how we use the term freedom in this country. It's often a way of saying that we don't care about our neighbor, because that's what this was. I mean, the freedom to what? The freedom to catch and transmit a potentially fatal infection? Is that your right? I mean, if you choose not to get a tetanus vaccine and you get tetanus, no one's going to catch tetanus from you. It's not a contagious disease. This is a contagious disease. And there are millions of people in this country who can't be vaccinated. They depend on those around them to protect them. Do you have any responsibility to them? And I think it was just this seen as a massive government overreach. Plus, I think we overpromised the vaccine a little bit. I think that those initial studies, which were really done over a period of 3 months, showed a high level of efficacy against even mild or moderate disease. But those were 3-month studies. Those people had just gotten their second dose. If over time, as antibodies fade, you're again going to be susceptible to mild disease. You should be protected against severe disease, which really only depends on memory, immunological memory. But mild disease, you could expect that 6 months later, protection against mild disease would fade. And it did. And I think people thought, wait, I mean, I'm mandated to get this vaccine. I got the vaccine like they told me. Now I've been, in bed for a couple of days. I have, cough and fever, and I feel terrible, and I've been nauseated. And, the government lied to me. That's the way it was seen. And I feel sorry for Dr. Fauci, who was sort of the face of all that. He sort of took all that upon himself. And I think he was viewed, at least by some, as being pedantic and condescending and sort of telling you what to do rather than necessarily explaining, like, this is why we're doing this. These are the issues at hand. And I just think we have paid an enormous price for that in an erosion in vaccines rates across the board. I think were there to be another pandemic, we have seriously tied the hands of public health behind its back.
So what should we be doing now to promote vaccines and vaccine safety?
Just educate as much as we can, passionately and compassionately, and in as clear of a way as possible that what vaccines are and what they aren't, and why they're still important. I fear that the only way we're going to kind of recognize their importance, frankly, is to see some of these diseases come back, which is sad because it's always the most vulnerable among us, our children, who suffer that. And I think that's what's going to happen. I do. Hope I'm wrong. Normally, I'm an optimist. I mean, I'm a Philadelphia Eagles fan, but I'm not so optimistic about this.
Besides educational medical writing, you were involved in the documentary Shot in the Arm, and you have a Substack newsletter called Beyond the Noise. And by the way, we will link to those show notes for everyone. What else do you have coming in the future with medical education?
Well, I'm actually working on another book, just the subtitle, which is "Who Can You Trust When Experts Give Bad Advice?" Because I think that's sort of where we're at now. I mean, you're seeing a lot of people who are experts sort of giving bad advice. People who, like Joseph Ladapo, an MD, PhD from Harvard, who's saying don't get the mRNA vaccines because they're contaminated with fragments of DNA that cause cancer, which is just utter nonsense. Those are the people that worry me. It's like Robert F. Kennedy Jr. worries me because he has a platform, and now he will have a bigger platform, but he's a lawyer. I mean, here are people who are trained. You have Dave Weldon, who will be head of the CDC. He's a doctor who thinks MMR vaccine causes autism, even though data have shown that it doesn't, or that thimerosal vaccines cause autism, which it doesn't. And he doesn't trust the CDC. He doesn't trust an agency he may be about to run. So it's troubled times.
What were you hoping I would ask you today?
No, that was great. I think that was great. I think that's what I was hoping you would ask me.
Okay.
What to do now in this troubled time, I think.
All right. Well, Dr. Offit, we appreciate your passion, and thank you so much for joining us and providing a balanced look at polio vaccinations.
Thank you, Jay.
Thank you. And thank you for listening to the On Medical Grounds podcast. OMG is your source for engaging, relevant, evidence-based medical information. We feature interviews with top experts along with complimentary teaching slides and continuing education credits on selected podcasts. At onmedicalgrounds.com and on our OMG app, we provide perks to all posted podcasts by linking content so you can drink in more if you so choose. Please be sure to click the subscribe button and be alerted when we post new content, or download our app to get all of our podcasts, slides, and continuing education credits in one convenient location. If you enjoyed this podcast, please rate and review it and share it with your friends and colleagues. This podcast is protected by copyright and may be freely used without modification for educational purposes. To find more information or to inquire about commercial use, please visit our website on medicalgrounds.com.